The same Inspector General's report, where we got those data for the map, also highlighted that one of the key barriers to access to services is the wait time, actually, for family and children. The average wait time across the state is 26 days, and a family or a child waiting to see a psychiatrist could be an average of about 31 days. So for children and families who are in crisis, we see that waiting a month to see someone really isn't going to help them through that acute crisis period. So now that you've seen a little bit about what is available in the state, I want to turn it over to a couple of folks who are going to bring this home as we'll start talking about numbers and start talking about people, which is what this is really all about. The folks that I'd like to introduce you to, first of all, are Vicki Hardy-Merrill. She is a parent, and she's also the director of the Virginia Federation of Families, and that's a program of Mental Health America of Virginia. And following her will be Mira Singer, and she is the executive director of NAMI Virginia. Thank you.
Thank you, Jennifer, and good morning. I'm very pleased and even excited to be here this morning to represent the hundreds of families across Virginia who struggle with the mental health issues that their children have. It's a mighty struggle, and they struggle every day about this. Virginia Federation of Families provides resource and service coordination. It's one of our key tenants, one of our key services we provide. And I get phone calls quite often from families who are trying to access services for their children and their youth. And I have here a sampling of some of the phone calls that I do get from the families. This is just a small representation of what we hear at the Federation of Families. First of all, there's a mother from Central Virginia who has a 14-year-old son who's called. The child has extreme behavior issues, so much so that it was posing a safety risk for the family. He currently is residing in a residential treatment center, partially due to the lack of community-based services that could treat him and support him successfully in the home and in the community. As the lack of services continued, his behaviors, of course, escalated to the point where he did need to go to residential. The family does feel that now this is the appropriate placement for him. However, they really believe if they had appropriate and proper and community services that kicked in quickly, they probably could have prevented putting their children into a residential treatment center. The community is working on developing a wider array of community-based services, but at this time, those services just are not available. And as an aside, this child's been in this residential treatment center for over 3 years. So this has been an ongoing issue. Okay. I also have another mom. This is a mom of a 15-year-old, a young woman who has mental health issues and aggressive behaviors. So much so that they had to, the family had to move out of their home. The mom and the daughter moved, so that the son, who was much younger than the 15-year-old daughter, who was being hurt, it was a safety issue, they had to move out of the family home so that they could keep the son safe. And in the meantime, they're still trying to access services for the child. And this is a family that lives in the Shenandoah area. I also have a little 7-year-old boy from the Tidewater area. The son's been hospitalized many times because of behavior and mental health issues. And the court now has become involved to help order services because it seemed to be the only way the family could really access services was going to the courts. Which to me personally as a parent I think is appalling that we have to go through the court system just to access services. I'm not talking about abuse and neglect, I'm not talking about issues of families not stepping up to the plate and providing services or the children becoming delinquent and things, but these are families just trying to get help. That's all they are. So if the family really feels that if they have those appropriate, adequate services, they could have prevented a lot of those hospitalizations. And I could go on further. I have books in my office full of the phone calls I get every day. And this is, again, just a small sampling, but I'm going to stop here. Federation of Families is very pleased to be part of this campaign, and we wholeheartedly support it, 110%, and I'm just so tickled to be here. And we firmly believe that now is the time to act. Now is the time to step up to the plate and help these families and to do the right thing to make it possible for them to get the help in a timely manner. Thank you.
Thank you, Vicki. Like the Federation of Families, the National Alliance on Mental Illness of Virginia works with families every day across Virginia who face similar challenges. As a statewide organization providing support, education, and advocacy, we hear from individuals and families every day who want to share their stories and indeed have incredible stories. It's very similar to what Vicki just told you about. There are so many issues that face families who try to access mental health services. Lack of availability, the financial hardship, the stigma of having a mental health problem, that it's really difficult to tell just one story. And instead, I'd like to quote some of the parents that I've talked to very recently. One parent says, "We repeatedly asked for help, but were told that he was a very complicated case and that no one knew what to do. Some professionals told us just to put him into foster care and walk away. Prevention, assessment, and early intervention are lacking." Another family said, "Stigma about mental and behavioral health and substance abuse is a costly and crippling problem. Our family members have varying understandings and tolerances for mental health issues. My father told me to dump my child on the street. There were many times I felt alone as a parent, and I knew that it was worse for my son." And here's what another parent says. "Fragmentation within the system is a problem that I encounter frequently. Private therapists often have no information about schools and/or hospital-based treatment for children with mental illness. One psychiatrist referred my son for day treatment when he was 11 years old. The doctor gave me 3 hospital numbers, but no one would treat a child under the age of 14. The financial toll raising a child with mental illness has taken a huge toll on my family. It often takes over a year to untangle the financial mess from just a short course of treatment." And there's one thing that you might not be able to tell from these quotes, but is very important to know about mental health problems. It affects children of all races, all socioeconomic backgrounds, and all ethnicities. There are families throughout Virginia, from urban, rural, and suburban areas, who face the same struggles. As you heard earlier, 1 in 5 children has a mental health disorder, and that's just a staggering number. And NAMI Virginia is very, very pleased to partner with Voices for Virginia's Children on this effort, because we realize that children's mental health problems is something that affects us all. These are children in our communities, they're in our schools, they're in our neighborhoods, and in many cases they're part of our families. These are our children, and we realize the time is now to do something about it, and it's time that we did something to help them. I'd like to turn it over to Margaret Nimmo-Crow with Voices.
Good morning. Thank you, Mira. Now that you have a greater understanding of the problem, I want to tell you what we're going to do about it. My name is Margaret Nimmo-Crow, and I'm the campaign coordinator for the Campaign for Children's Mental Health. The campaign is the first ever 3-year advocacy effort to make children's mental health services more available and accessible in Virginia. To accomplish this goal, the campaign has several key components. First, as John mentioned, we've established a statewide coalition of partners who work with us, have worked with us, and also some non-traditional partners we haven't worked with in the past. Juvenile justice, those who work in education, and parent organizations, just to name a few. The list in your packet is also just the beginning. We will be continuing to sign organizations on as supporters, whether they're statewide associations or local organizations, and they can all go to our website, 1in5kids.org, learn more about the campaign, and sign on. Second, we're going to mobilize grassroots support like never before on this issue. We want to make sure that policymakers hear our voices. If 1 in 5 kids has a mental health problem, just think of all the parents and family members of those children who are voters. Our policymakers need to hear from them. Now is the time for families to share their stories so that our policymakers understand what needs to change. And again, parents and family members can go to our website for the campaign, 1in5kids.org, and they can share their stories. They can use their names or they can share them anonymously. But the more that we get these stories out in the open, the more our policymakers will understand the issues.